All right, and we're live. Good morning, ladies.
Good morning.
Good morning.
Good morning to everybody watching. So today we are here. It's been a long time since we've gone live, and we've missed everybody, but Danielle and Terri have been very, very busy. They had their Breast Implant Health Summit back in October, and I wanted to have them both on today to just do a recap, really, of what the Health Summit looked like and kind of what everybody's takeaway was from it. So thank you guys for being here.
You're so welcome. It's good to see you both, actually.
It is.
I agree. It's been too long. So, all right. So let's talk about the summit. Danielle, I know this was your vision initially, and you, I want to know what was the mission that you wanted from the summit?
There were a couple, actually. And the first one was just to make like an academic-based awareness for everybody, especially practitioners, all kinds of practitioners, from your primary care to your massage therapist, to your personal trainer, to your oncologist, to, the immunologist, for people to realize that while we're trying to figure out exactly what it is and exactly how to help us, it's a multidisciplinary approach, right? So, and it took all of these trails of inquiry for me to heal. So I was hoping to broaden that. And in the very least, right, have it be that the primary care people start to ask and realize that implantable devices can and do affect the body in a negative way, right? And so I just really wanted to provide some evidence-based medicine on that and on a global level. So yeah, and I think it did. Like, we can talk to how many countries we
so that's
had
my
present.
question. So now that the summit has happened, do you feel that it's mission accomplished? Who did we reach, and who were we talking to, and how did it go? How do you both feel?
Terri.
Okay, well, so we hit the countries that we had was Australia, Brazil, Canada, Costa Rica, Germany, Indonesia, the UK, the United States, and Mexico. So those are all the countries that participated in our summit. So that, I think that's pretty global, and it definitely created some awareness. As far as I feel that there's a lot of work to be done, but I will always feel that way in this, advocacy work. But I really do feel like we have started climbing the mountain, and that there's some awareness.
Yeah. Right. This year's summit was so big. I think we had approximately 36 hours and 3 days, 35 presenters. And, I really wanted it to be broad and have the impact, because it is all that, right? I don't know that there was one lecture that wasn't pertinent to either the practitioner or the BII patient, or just learning that it's a possibility to get it out there. From breast health to cellular response was the whole gamut. There is a lot of work to do, a lot more work to do, a lot deeper dives. But it was fascinating, so.
Yeah. And as a viewer, I really felt like, it wasn't just about breast implant illness. It was implantable devices, like you said. There's a takeaway here for so many people, to really, learn and grow and understand more about how the body works and why we are not necessarily designed for implantable devices. Yes, there's a time and a place, because some of them are life-saving, but to really just truly be informed, I felt like this was such a huge takeaway. So I thought you both did an amazing job, and I want to, from the bottom of my heart, thank you on behalf of our entire community, because I think that you both did so amazing. And for anybody watching who hasn't seen the summit yet, it was amazing. And if you do have the means to register, we'll go over that in a little bit. But these two worked their butts off. I can tell you that they put their heart and soul into this, and it really shows. And I know that probably thinking about doing more summits is a daunting task. And I think Danielle's probably going to hang up on me now. But like Terri said, this is just the beginning. We've just kind of grazed the surface, and now we really need to dig deep and get practitioners not just the knowledge, but the comfort level. I think that there are some practitioners that are even afraid to ask the question, do you have breast implants or do you have an implantable device? And we need to get rid of the stigma around that and let them know that it is okay to ask. When I had breast implants and before I knew about breast implant illness, I would have been okay with them saying, hey, do you have implants? Let's talk about it. It wouldn't have been embarrassing to me. So I think we need to even, just get into that. There is so much more work to be done, but you guys are amazing. So thank you.
Thank you, Tara.
So I just wanted to say that, like I said, as a viewer, there was a lot for me to take in. And I now have the recording that I'm able to go back and watch, which is amazing. And I just feel very blessed that I have that. How long do I have that, by the way? Is that like?
Well, for sure till March 1st, but I actually think, so when we initially started, we were doing a Zoom platform, and that we had to pay a month, every month. And with Vimeo, you just have to upload. So the commitment that I will maintain the site is till March 1st, but it will be longer. But I'm letting people know when they purchase the registration, it's 3 months.
Okay, that makes sense. So I just wanted to go over a couple of just key points for somebody who's watching who may be like, this is the first time they're hearing about the summit, or, they were curious before, but now they're like, maybe I want to purchase that. So first of all, it's, this was practitioner driven, right? So you really wanted to reach the practitioners and give them the knowledge. So for them to join, that was $150, correct?
Correct.
And for any woman who's in the breast implant illness community, she would receive an automatic 20% off. If she were able to get a practitioner to register, she gets
50% off.
50% off. And then if she gets 2 practitioners to register, it was free. Am I correct? Okay.
Correct.
So those rules still apply. So anybody who is watching and is interested, go to breastimplанthealthsummit.com and you can still purchase the recording, and you get all 7 hours of
over 30, let's say over 30 and 35 presentations, actually more than that because we did some lives there too, but the full 3 days for sure.
It's such an amazing amount of information. I was personally so excited about Dr. Tavert, the first gentleman. Is that how you say his last name?
Okay. Tavert, yeah. I
think he is just such a gentle soul. He's one of those people that you just want to be in his presence because I feel like he's just such a nice guy. So I was really excited about him, and of course, Dr. Ben Lynch. I felt like I was a little starstruck by him. That was really cool. So my 2 takeaways as a viewer were, I'm now 2.5 years post-explant, and I now know that I want to definitely have a full body thermography scan. That's something that I feel like I would really get a lot out of, knowing where my inflammation is, how much inflammation is there, and I feel like that would be really nice to have. Is there anything about thermography? And I think there was a couple people who spoke on it, or at least 1 or 2, about that. Is it something that would be good for me to do?
Oh, yeah. I think so. It doesn't replace MRI. It doesn't replace ultrasound. It doesn't replace mammograms, right? It will show you. We had Dr. Dillon, and then we had Miss Cron speak, and both of them use thermography in different ways, and both are very valid to find where your congestion is, especially around lymphatic congestion. And what we're learning, and I think if there was any theme is about T cells and spleen and lymphocytes and lymph, a system, is that we as practitioners and BII people need to take a look at how do we beef this immune response? How do we beef up our immune system? And looking to see where you're congested and, doing whether it's your at-home lymphatic therapy or finding a lymphatic practitioner near you, I think is definitely is a big take home for me for the summit.
Okay, yeah, it's definitely the first on my list, because after that comes lymphatic massage. Somebody that can, when I do it at home, I'm not feeling it like I feel like I should.
Well, there's a lot of nervous system regulation when you have hands-on therapy, whether it be osteopathy, whether it's a massage therapy, craniosacral therapy. We talked a bit about something called cell danger response, and we talked about the autonomic nervous system, and all of these work together, and whatever we can do to down-regulate the sympathetic overdrive and upregulate the parasympathetic is an add value, right? And I love lymphatic and visceral work. It's why I added it in my practice with my clients. So I'm a fan.
Yeah.
And in the summit, I don't know if you saw it, but there's an actual instructional part of the summit that will show you how to do your own lymphatic massage.
Yeah, Dr. Nicholson, Perry Nicholson from Stop Chasing Pain. So.
Yeah, that's awesome. And again, this is not just for women with breast implants or who had breast implants. This applies to globally, everyone. So that's what I'm saying. Like, this is, we're on different pages here live, and we'll be on YouTube. And for anybody watching, like, this isn't just women who have had implants. This is for everyone. There is a takeaway here that is so important. And, I feel the shift I can only speak to our country, but I feel the shift of people, from the Eastern medicine, Western medicine standpoint. And I feel like people are now kind of taking a step back. Like, I need to get to the root cause of my issues, regardless of who you are and what you've been through, and stop just treating symptoms and putting Band-Aids over things. I think there is a total shift that's happening here. And so this all kind of applies, and I'm really, I'm just so excited about that. So, so this is for everybody watching. So those are my two things that I plan to do: the thermography, and then someone to help me with my lymph, because I still have swollen lymph nodes. And I feel that in order to really
Danielle's ready to put her hands on you. That's what that means.
Right? So those are my two things. Terri, you were such a huge part of this. I know you were Danielle's right-hand woman.
Partner.
What was this like for you, being a part of something so huge?
Oh, well, the information, every presentation, to see it as it was happening, like, to get that information was so amazing and overwhelming at times, because I didn't realize I'm not a practitioner. I don't have like the brain like Danielle does, and how she sees it and dissects it. So I see it from a patient standpoint. And so it was really eye-opening for me to know, and also as an advocate, to see. That was the main thing I would say for me as an advocate. There's so much publications already out. This information has been out for a very long time. So as an advocate, I was kind of mad, because I'm like, oh, wow, this stuff is there. There is plenty of evidence and educational evidence, not just woo-woo, oh, this is happening to me. This is real stuff. And that's what really was the takeaway for me, is just, or that excitement of just seeing every presentation live and watching it evolve, like watching, the baby grow, and then just the, advocacy side.
That's awesome. That's so great. I can imagine that, just being, I know, watching you guys, I was in awe of just listening to the speakers and having you guys there to ask the questions. And, because we are such a tight-knit community, it was like, oh, I would love to, and then you guys would ask, and I'd be like, So it was just really so great. So I really, were there any, I know what I want to ask. Danielle, what did you learn? Was there like one or two things that I know not that you didn't learn, but like things that like blew your mind, like, oh my God, I didn't
every day, because you know how Danielle's face goes, like you could see it in her face. That's what I saw every day, her awareness. That's what I meant by seeing it from a patient side to a practitioner side, because I could see her brain just going, how do I use this? How do I,
So what would be like one or two things, Danielle, that really just, you were like, oh my God.
Yeah. So first, most everyone on there were, at least over the last 3 years, either my mentor directly, or I used their modalities to in my journey to get well, right? The biggest, and I don't know that there's one, but the first couple that we listened to, Deechcom, Capel, Persian, and if they're listening, I apologize for brutalizing their names. And Eduardo Flore, Dr. Flore, MD, PhD from Brazil, radiologist. We have been, as a community, looking for the objective data of how to put the symptoms with something. And as a medical professional, like, it's really hard to take symptoms and help you with just the symptoms, which I can do, but it's not the root cause, right? And so, there are many clinical studies out there. But what blew me away was that anyone can have a breast scan, breast MRI sequencing, and you can, if trained, look for what they call these little silicone granulomas called SIGBIC. So I've already started to use this as a diagnostic tool in my practice, where if someone comes to me with symptoms, and they can have an MRI, because that's expensive too. Dr. Flore made this margin, this window. If he looks on your MRI and you look for this, check, plus symptoms, then we know for sure that when you remove the implants and the capsule, those little granulomas you saw in MRI is, silicone-induced granulomas, and he calls it SIGBIC. So that's our first objective data, and he's done, I need to collectively look at the number, but about 100, if not more. So we're actually looking to reproduce that study in a multi-center. I know, you guys, this is a little heavier, but that's mind-blowing, because that's our diagnosis, guys. And we need more data, but that's as close as we got to, the smoking gun, if you will, to help us heal. So if that's true, and then we explant, we already have the studies showing explant helps, most, right? Mm-hmm. And so what I then found out, which blew my mind, was Dr. Dempsey's mast cell conversation, and that not all MCAS is mast cell syndrome, but I do think we are all triggered mast cell wise. And so how do you identify where your trigger is, and how do you look at that? So I'm looking at our symptoms in a whole new light. And then, hopefully with her tutelage, learn more to how to actually treat. So we need to clone these people and do more things. And we need funding for these studies. It's not going to happen. And that's what the summit is. We pay for operating costs. We pay for hopefully some clinical studies and some advocacy that we need to do, and to facilitate that. Those were my two. There's so much more, but those were my like, what? Right. And then Deech comes, and the platinum, and getting the gel bleed. Like, what do you mean bleed? Diffusion, osmosis, like it happens. And, digging into the manufacturers even say it does. And so if it comes out of the shell and into the capsule, it's got to get past the capsule into the body. So are we doing enough? I have so many questions. So those were the three topics. I kept it to 3. I know you asked for 2, but
You did great, Danielle. That was great. And all of those, absolutely. I mean, to have some tangible, objective, evidence here is huge for us, because it is the way it is. This illness is so kind of all over the place. And so to have that, that's huge. And so all of those points are amazing. And Terri, as a patient, did you like need to take away anything like, oh, I need to do this for myself, or?
Lymphatic, definitely, because my explant date was yesterday. It's been 4 years for my anniversary. So, and I'm still detoxing. I still have, not a lot. I mean, I am so much better, but that was the main thing that I took away is I don't think I took care of my lymphatics as much. I do Epsom salt baths. I do other things, but that is not so that was a good takeaway for me.
Yeah.
And I'd like to say a little medical caveat, or that sounded a little pretentious, but we don't know what is best, right, to do for the silicone in our lymphatics in our body. We don't have data that says, do this, do that. What we do have is real world experience, right? Now, it's a controversial subject around lymphomas and tumors, and you don't want to get them to metastasize. And we know that a healthy body, it involves movement, involves breathing, and that is what moves your lymph, right? So things that are stagnant tend to grow things on them and in them. So it's my just opinion right now, and hopefully we can look into it more, is movement of our bodies, of our lymph, is more advantageous than not. I see that a lot post-explant. And I think, ask your doctor, check to make sure they know what lymphatic drainage is in therapy and what things to do. Heat, movement, vibration are all key things. And when you're hurt, we tend to not move. We tend to restrict. We tend to have different kinds of postural strain. So.
Yeah, for sure. I know. I feel like I'm getting all these signs. I don't know. I'm a big believer in signs, right? So I watched the summit. I've been thinking about the lymphatic system a ton and my lymphatic system, personally. And then I went to I don't know, it was like a vendor, like a festival kind of thing. And there was vendors there, and I got information on a lymphatic massage therapist in the area. And I was like, oh, this is so cool. And then I saw, I don't know, I forget what I was watching, but I saw something on TV and they were talking about how when your lymph is not moving correctly, you have a risk of developing cancers and things like that. And I was like, okay, I'm listening. I'm going to do this. I promise. So this is my promise to myself. And, really it was the summit that sparked it for me. So that was huge for me. And I know Danielle has personally talked to me about it a ton. And sometimes it just takes, just people knocking on your door. Like,
do you remember day one at the FDA?
Yes, and you put your hands on.
Can I touch your sternum?
Yep, that was great. And I was like, "It's nice to meet you. Can I touch your chest?" So yeah, for people who are going to be watching this on YouTube, I'm going to find this lymphatic massage therapist. I'm going to go and I'm going to ask them if it's okay to tape it, and I'm going to have you guys, watch and just kind of, go through it. I want to be transparent, and I want people to see that, we can do this. It's not going to be scary. We're going to get through it and kind of get our bodies flowing again. I think that's what it's all about. So I think that was a huge takeaway for all of us here. So is there any last things that you guys want to say before we finish? I want everybody to know that our plan now is to, kind of dissect some of the main topics that were brought up during the summit, and we're going to be doing more lives. And, maybe we'll, if it's okay with Danielle and Terri, we'll reach out to some of the presenters and see if they would be willing to do this with us, so we could get firsthand information right from the source. And but we really want to continue to get this information out to you guys. We did have one comment from Deborah, who mentioned TED Talks. She's a nurse practitioner, and she's working on getting the information out into through TED Talks. I don't actually know anything about TED Talks. Do you guys know anything? So,
no.
Set up. Yeah. You'll have to, Deborah, you'll have to talk to us about that. And, maybe you can come on and talk to us too. So,
yeah,
it's words that you guys have.
if anyone has any questions, like if for those of you who have registered and are watching the videos from the summit, you know, on the breastimplанthealthsummit.com website, there's a chat button. You can ask the question there or send an email. I think you can even do that through Vimeo. And what we're tallying up the frequently asked questions, and we're doing our best to get the originator or the presenters to ask. If not, then we'll do second best, and we'll get the answers to you, and we'll somehow either on our website or somewhere that we'll have the answers to those questions, so we can, you know, I'm sure if one person has a question, at least 10 others do. So let us know how we can help and what you're needing.
Perfect. Terri, anything you want to say?
I'm just excited that we're still, you know, getting this information out. And I really feel that it's an important subject. Like there's well, I shouldn't say one subject. There's so many subjects in all of it. And it is a lot to digest. And that's the reason why we're leaving it and letting people take it slowly, because I was there and then I've watched it again because I was there again, and I've watched again, and I still get different things out of each presentation. So if you have any questions, you're more than welcome to contact, you know, me, Danielle. We'll be happy to help you. Any logistics of trying to get signed up or set up, you're more than welcome to contact me as well. I can help with that.
Yeah,
Discounts.
If you have BII and you are working to get your practitioners to join, reach out to Terri and I, because we have a different code for you. The Vimeo right now is just the full registration. And we're working on how to make sure we can give discounts to people too. Keep in mind, it is only Terri and I right now anyway, and we will get back to you. And you know, we want everyone to have access to this, and we also hope to raise money and awareness for some clinical studies and some, you know, different type of advocacy work. So, thank you.
Perfect. Thank you, ladies. Yeah, I think it took us so long to come on and do this recap because there was so much information, and I feel like we were all kind of just processing it. And I know you guys needed a minute to just come down from all of that. So, so I think that's what took us, you know, a little while to get back here. But I feel like now this is the beginning of, you know, a continuation for the summit. The summit wasn't just that weekend. The summit is going to continue. You know, people are going to continue to learn and grow from this. So as much as Danielle wanted one and done, it's not happening.
Yep.
So, all right. So you have all the information that you need here. We appreciate you guys, you know, tuning in today. And I just want you both to know that I am in awe of everything that you've done. And I love you both. And thank you. And thank you for being here today. So we'll see you guys soon.
Thank
you, Tara. Bye, everyone.
Bye, everyone.